We're almost halfway through the year, and a lot of people are running on empty without fully realizing it. Grow Therapy helps you find care that's covered by insurance before burnout becomes the baseline. Whether it's your first time in therapy or your 50th, Grow makes it easier to find a therapist who fits you, not the other way around. They connect you with thousands of independent licensed therapists across the U.S., offering both virtual and in-person sessions, nights and weekends. You can search by what matters, like insurance, specialty, identity, or availability, and get started in as little as 2 days. And if something comes up, you can cancel up to 24 hours in advance at no cost. There are no subscriptions, no long-term commitments. You just pay per session. Grow helps you find therapy on your time. Whatever challenges you're facing, Grow Therapy is here to help. Grow accepts over 100 insurance plans, including Medicaid in some states. Sessions average about $21 with insurance, and some pay as little as $0 depending on their plan. Visit growtherapy.com/booknow to get started. That's growtherapy.com/booknow. growtherapy.com/booknow. Availability and coverage vary by state and insurance plan.
Welcome to the Medical Nursing Podcast, the go-to show for vet nurses and technicians passionate about internal medicine. I'm Laura Jones, a registered vet nurse, all-around medical nursing nerd, and your guide to breaking down complex medical diseases into simple, actionable chunks. Each episode is packed with knowledge and tips that you can start using right away to give even better patient care. So let's get started. Hello and welcome back to the Medical Nursing Podcast, or welcome if it is your first time listening. You are listening to episode 113 of the podcast, which is where we chat all about internal medicine and the role that we play as veterinary nurses and technicians in the care of these challenging but rewarding patients. Now, I'm recording this on the 1st of May, which is the first day of Veterinary Nursing Awareness Month, which is the month where we come together as a profession to celebrate, acknowledge and highlight our skills, our knowledge, and how this can be better utilised by our profession. And in this episode, I am doing something very different because for the first time ever in the history of the podcast, I'm bringing a vet on to speak to us. But this isn't a clinical episode. It's a conversation that I think we all need to have about what vets really think of our role, our knowledge and our skills. And I think it's really apt that we're recording this on the first day of VNAM. And this is something that I've had in the works for a while, because one thing that I see quite a bit, given that social media is a big part of my role, is that there can sometimes be a bit of a divide or a perceived divide between vets and nurses. So I'm not saying that we hate each other or we don't work well against each other. I love my vet team and we work together so well. However, lots of vets don't have a great understanding of what we can do. And we also don't have a great understanding of the vet's role either. So instead of communicating about this openly, sometimes there can be a tendency to assume about the other one's role, or sometimes assume that we're not valued, appreciated, or allowed to use our skills. So I thought, what better way to change that by bringing on Scott Kilpatrick, who is a veterinary surgeon and a specialist in internal medicine. Not only is Scott a vet, he's also a vet that works very closely with nurses and technicians, and I think probably it's safe to say couldn't do his job without them. And when not working in clinical practice, he's also one of the directors at VTX, who are tirelessly championing veterinary nurses. So Scott is just an all-round amazing human, friend, and someone who truly cares about everyone in this profession, regardless of their title or their role. If you have ever felt disheartened by a vet-nurse divide, or you felt unsure on how to approach your vets about something like using your skills, sharing your opinion about a case, or suggesting a treatment for a patient, then I know that you are going to get so much value from this conversation. So, hello Scott, how are you?
Gosh, that was a wonderful introduction in so many ways. I'm okay. I'm actually maybe more overwhelmed now that you said all that. I was already a bit overwhelmed, and then I didn't realize it was actually I'd forgotten it was the beginning of Veterinary Nurse Awareness Month, and so that puts additional pressure on. I think being the first vet on here is wonderful and an honor, but also very I'm again overwhelmed and intimidated. So I think
don't be intimidated. You're basically an honorary nurse, Scott, which is high praise. That's more important than your internal medicine diploma. So
Don't. Yeah, so I hope I do a good job of this. So anyway, yes, okay, I'm not going to overthink that, but that was a very a wonderful sort of introduction and framing this whole thing. So thank you for that.
So I wondered if you could just get us started by, for the probably like three people that don't know you out of everyone that's listening to this conversation, because of obviously VTX and your presence online, could you tell us a bit about yourself, your background, and sort of where you are in your career?
Yeah, so I'm a veterinary surgeon, and I very proudly qualified from Edinburgh University. That is important to me
Yeah.
because I
Yeah.
don't know, it just is that those sorts of things maybe do matter. So yeah, so I've been in the profession for a long time now. So I've been qualified for 20 years, and I did some postgraduate training and became an internal medicine specialist for what that's worth. And I've worked in clinical and academic practice, and now actually I work and live on Vancouver Island in Canada. So, but I'm still in full-time clinical practice there, and actually currently enjoy that, and I've not always enjoyed my work, and it's been a very challenging career in so many ways, but I'm currently in actually quite a good place. So it's a good point to be talking to me about the veterinary profession, because I'm feeling optimistic about the work at this point. So that's a good thing. But I also founded, as you said, VTX, which is a CPD company or a CE company, which I do with my husband Andy, who's a veterinary nurse or technician, and with a cardiology specialist, Liz. So that's another big part of kind of what I do. Yeah, so I feel very fortunate to have all of that going on, and but clinical work is still very much probably the only skill I have. Like I think like what, if I didn't do clinical, I mean, what else would I do? I don't really know how to do anything else. So I have to do that because that's all that I know. I mean, that's really all that I know what to do. So there you
I
go.
think if you took us all out of the profession, we'd just end up like on an island somewhere with no idea how to
Oh my
like do anything
God.
really, wouldn't we?
I know, and there's so many people diversifying vets and nurses, and I have so much respect for that. But I think if you remove me completely from the profession, I mean, I genuinely have no idea what I would do or would have the skills to do. People talk about transferable skills, but I'm really not sure. Do I have those? It's a weird thing. Anyway, the job's fine at the moment, so I'm happy sticking with this.
Good,
Yeah.
good. So you're busy with clinical practice and also
Mm,
in whatever hours you've got left alongside that, also like having a life and working in practice
hmm.
and running VTX and teaching
Yeah.
and also
Yeah.
everything that goes with it. So
Yeah.
I think one of the main reasons, if not the main reason that I wanted you to be like the vet that came on is
Mm,
because I know from being a medicine nurse how closely, especially in referral practice, you have to have that relationship in between your vets and their nursing team or their technicians.
hmm.
So in your role kind of day to day, I guess what I would love the audience to get a bit of a feel of is how much you rely on you would be technicians for you, but nurses, technicians,
Hmm.
and kind of what your working relationship kind of looks like day to day as a team in that respect.
Yeah, I mean, I think you know, I could not function without them, and they could not function
Yeah.
without me, right? So I think like what I look at, I'm very much of the opinion that we need to really look at, nurses and technicians and vets and as they're completely different jobs. They
Mhm.
are completely, and that's maybe where some of the problem comes in actually, where they're not some weird extension of me or like some like assistant to me. Like that's not the way I see technicians and nurses at all. Like
Mhm.
they're not working at some level below me and just doing all the things I ask them to do. That's really not how this is working. I have a very clear job role. I'm qualified in a specific thing to do a specific job, as are they. They are qualified to do a very specific and a very different job. And it just so happens we really couldn't do our jobs without each other. And that's great. So we work very much together. And, the thing is, the patients that come into our care would not get good care, would not get the all-round care that they need without every part of that team. And I provide a service, I provide a plan, I provide, diagnostics and treatments. But the technicians and nurses are doing, their part of that whole big picture, and really without their contribution, it would be almost meaningless. Like truly, like where would we be? And so there's so much to do with that patient journey and things that I'm not even aware of. Like it was so funny the other day. I happened to go out and be in the, or be in the waiting room or be in the consulting room when one of my technician colleagues was discharging a patient. And I had never listened to her do that before. Like I'd never, and there was this whole conversation and part of the thing. And I was like, oh God, I've never listened to you do this before. Like I didn't even know that you said that, or that's really clever that you said that, or like, it's almost, and in many ways I felt bad about that. But it just shows you that they're providing their part of the puzzle. And sometimes I'm not even aware of what they're doing. You know what I mean? But in answer to your question, the without each other, we would all just be lost. And I certainly would not be able to do any of the things that I do to the level that I do them and the quality of the service we provide without the technicians or nurses that we're working with.
Yeah, definitely. And I love that I love the first thing you said about it being very much looking at both sides of it. We can't do our role without you, you can't do our role without us. Because I
Hmm.
think what we end up sometimes getting fixed on is that kind of polarization and division. And I actually think we almost need to stop thinking about vets and nurses and just think about a care team that looks after that
Yeah,
patient.
yeah,
Because
exactly.
as you say, everyone has very different skill sets and a different area of focus. And that's not a bad thing. It is very much like when you approach a case, you've got your like medic hat on. There's a certain list of probably more clinical things that are going to be top of mind for you. If I approach that same patient, the things that I'm thinking about are going to be different because I'm approaching it with a nursing hat on.
Exactly.
And that patient needs
Hmm.
both of those to have the best possible care. And you
Exactly.
can't get the
Exactly.
information you need about a case without getting a full picture from the nurses.
Hmm.
And the nurses can't look after that patient effectively without having that close working relationship with the vet that's in charge of the care.
Exactly. And it's exactly right. And I think and it's the fact that you need, having one person, this one, specialist or vet or whatever, that's the kind of the only decision maker or the only thinker in the room is so dangerous,
Mm,
because you need other voices, you need other perspectives to be able to give good care to patients because you cannot rely on one person, regardless of how qualified they are on paper, to be the only brain in the room making decisions or questioning or discussing. I mean, that's dangerous in itself. So we need multiple voices looking at things from multiple different angles and perspectives to be able to provide the best care that we can. And I think again that's why we've got to, in the bad old days, I think, I mean, I first stepped into a veterinary consulting room when I was 12 years old, which is a long time ago now. And, in the profession at that stage, I think nurses or technicians were sometimes kind of an optional extra. They weren't even like, considered a necessity. And the qualifications varied greatly and the people that were allowed to do those jobs, and so I think, we have moved on a lot from then, but I think we cannot, nurses and technicians are not an optional extra. They're not, they are fundamental to the system. And they are, again, they need to be viewed in a very different light on the same level. We're not these kind of old hierarchical systems. That's also very damaging and makes it all a bit weird. We're not, one is not below the other. We're just different. It's different jobs.
exactly.
It's different jobs. If I went into a hospital, I would want the doctor to diagnose my medical problem. I certainly would not want the doctor looking after me or providing my care. I wouldn't. Why would you want that?
No, yeah,
Why would you want that? I wouldn't want that. And I certainly would want to see a team of different professionals, nurses, physiotherapists. I would want, I'd want all of that. I wouldn't just want some doctor doing all the stuff. And I think actually that care team, and actually the language here in North America, well, in Canada and North America, whatever, they do talk about having more other people on your team. And I've heard that come up a lot. I really like that.
that's
I don't know,
nice.
that's maybe not language I've heard before, but we're looking for other people on the team here. And I like that. It's just, and let's have lots of people on the team with lots of different ideas and skill sets.
Yeah, definitely. I think it brings so much to the clinical environment you're working in. And it also takes the pressure off of everyone as an individual. I think one thing that nurses probably don't have a great handle on is the amount of pressure that you guys are under. And
Hmm.
actually just being able to know that you've got a team of people that are going to help you manage that case takes a lot of that pressure off.
Hmm.
And it means it's not one person, as you say, feeling like they have to make all of the decisions and that all of the responsibility lies on them, especially
Hmm.
because there is so much responsibility that comes with that role. And I think one thing you said as well about it being really dangerous for one person to make the decision. I think hierarchy really fits into that well because if you are a nurse in practice that feels scared to mention something,
Hmm.
if you spot that there is a problem with a patient, but you feel scared to mention it, that's so dangerous.
Hmm.
Like I had that, I was a student nurse. I was where I worked when I trained was a group of small clinics that were branches that were attached to one main hospital, which I think is like back in the day, that was nearly 20 years ago. That was kind of how a lot of practices were, like the little mini independent groups. I
Hmm.
usually worked at a really small branch and I went to go and do a day covering at the main hospital. I'd only been training for 6 months. I didn't know any of the vets there. They didn't know me. And I was monitoring a patient who was recovering from, I want to say it was like a diaphragmatic hernia or something. It was big. Like I had never seen a case like that before. I was so scared to go and, pull the vet out of a consultation because I was worried that I like got up a little second, went and knocked on the door, and I was like, I think there's a problem with this patient. I knew there was a big problem with this patient, but I was scared to put them out.
Hmm.
The vet walked through to the consult, the cat had arrested.
Hmm.
And that was the first CPR that I ever did.
Hmm.
And I was 17 years old. So, I mean, obviously, I was a child who was scared at that time as well. But I think if you have that kind of innate inbuilt hierarchy, you're just asking for trouble because it means people don't feel safe to speak up. And that means that it's harder for everybody to do their jobs, regardless of your job title.
Hmm.
So I love that that was sort of a reflection there as well.
I think I think we still really struggle to shake this hierarchy. I actually think, interestingly, for me, it's slightly worse in Canada than it was in the UK. And I think that there is more of a kind of pedestal built around doctors. Like I never introduced myself as Dr. Kilpatrick ever, ever. And actually I just never do. And
I'd
then
imagine if someone called you that, you'd want to like melt
oh,
into a
I
hole
hate
on the
it.
floor.
And I said, if you want to call me, if you want to call me Dr. Scott or what, like that's kind of a bit more, you know, kind of slightly sort of more relaxed. But I never introduced myself as Dr. Kilpatrick. But I definitely there's more of that. There's
Mm.
more of that, and I think that I feel that more. I feel that more here even than other places that I've worked actually. So it's definitely still a thing. The hierarchy thing is still a thing, I'm
Yeah.
afraid. Yeah.
But I think it's going to take more conversations like this to
Hmm.
challenge it and bring it down, which
Yeah.
is good. It's only a good thing, I think, that we're talking about it because it takes talking about it to change it.
But there's no, I mean, if there's any hierarchy, like, if I was if I'm a senior clinician and I have a resident
Mm.
or an intern, I'm going to treat them with a great amount of respect. But I suppose, I mean, there is a natural hierarchy there.
Yeah.
Their training, they're going to be taking direction from me clinically. The reason they're there is to learn from someone more senior. And again, I'm not saying we should be having like a really, the old style kind of internship residency where people were treated like crap. I'm not saying that, but I'm just saying there is some degree
They
of
have to learn, they have to train.
exactly. But when it comes to the technicians or nurses, it's again, I don't see it like that at all because their job is different, so
Mm.
we're on a completely different track, and they
Yeah.
are not looking up and being I'm not responsible for everything that they do. I there's we work within guidelines, right? So there's rules and regulations and laws that say there are certain things that I can do that technicians or nurses can't, but it doesn't mean that I'm in charge of them. And again,
Yeah.
we need to look at that in a different way, and I think that yeah, it's just a different thing, and that the hierarchy thing as far as the vet is the top of the tree and then everyone else is below. I mean, that's just not true.
Yeah.
It's just not true. Like I'm not, it's just not true. That's not the way it is at all. And certainly in my world, that's just not the way it is.
Yeah. It is very much, I think we always need to reframe the kind of archaic belief of it's vets. than nurses because it's exactly as you say, if I work in practice, my line manager is not the head of medicine. It
Exactly.
is whoever the head of nursing is in the practice,
Exactly.
for
Yeah,
example. And you have a close working relationship, but it's not the same as you working like underneath them. It's a totally different set of skills that we perform in tandem as a team.
exactly.
So, I wanted to also chat a bit about kind of utilization of our skills and where that kind of fits into things. Although I think we've probably touched on it a lot already because our skill sets are so different.
Hmm.
There is, of course, as you say, a certain list of things that we legally cannot perform that vets can.
Yeah.
But I think realistically, when you look at that list, depending on where you are in the world, in the UK, that is diagnosing, prescribing, and major surgery or surgery that enters the body cavity. In the
Hmm.
US, I don't know if it's the same in Canada, but in the US, it's prognosing, diagnosing, prescribing, and any kind of surgery.
Hmm.
They are the things that we are not allowed to do legally.
Hmm.
I don't particularly want to do surgery. There was a reason that I
Neither
work in
do
internal
I.
medicine.
Neither do I.
Don't really
Yeah,
want to do
great.
that. And I don't
Yeah.
particularly care about a diagnosis, even though I feel like working with medics for a long time,
Yeah.
I get a feel of kind of what could be going on with a patient. And I don't really care about whether I can legally prescribe a medication.
No, it's a
There's
pain.
so much more that we can do outside of those three or four things.
Yeah.
And I think one thing I would love to kind of bring awareness to is how vets can utilize nursing skills and knowledge more. Because I
Hmm.
think there are so many ways that nurses can do more to help. So I'd love to know, like, what are some of the things that you rely on your nursing team for
Hmm.
day to day, or ways that they're able to kind of utilize their skills in the care of, your and their patients?
I honestly, one of the things, the first thing that comes to mind for me is, and this may, I hope this doesn't sound like basic, is that their involvement with client communication. Like I do, like that is for me, that is so important. The cold hard facts are certainly from my job as an internal medicine specialist vet, really the most important and critical part of my job is actually the communication of everything with the client. I mean, that is like, I'm not just saying that because that seems like the right, I mean, that is so true. It's unbelievable. It doesn't really matter what fancy things I am doing or performing. Really, the art of what I do is to do with the way that everything is disseminated to the clients from a communication perspective. And having the nurses and technicians involved in that process, speaking to the clients the day after a procedure, being involved in kind of, client follow-up, even if that's just, on the telephone, is so critical. And empowering not just you as the vet to actually be able to talk to clients. I mean, I think that seems really basic, but that is so important. We should not gatekeep that just to ourselves.
Yeah,
Um,
I agree.
and with discharges, technician appointments or nursing appointments, which we do a lot of, that is so important, and it really helps with kind of workflow, and it's really good for our clients, really good for our clients to not just have one person that they can speak to. And I routinely get feedback from my clients saying, and they'll email, and it won't just be dear Scott, it'll be dear Kristen and Erica. It'll be the other people on my team who are involved in their care. And I routinely will get positive feedback about other people that they've spoken to. So for me, that's really, really critical. I mean, I think
Yeah.
it's a no-brainer to say that once the initial consultation's done, our team are involved in almost everything that happens with that patient, apart from specific procedures. So I have not taken a blood sample in over 2.5 years. I have not placed a catheter. I'm truly in 2.5 years. I have not, our technicians will do, lump FNAs and all that kind of stuff, like all that kind of stuff. I've just done none of that stuff. They will place every placeable thing and, do every procedural thing that they can possibly do. I mean, it really, there's very few things that I actually do. I do endoscopy.
Because
Um,
this podcast is basically just taught us the vets don't do anything.
no, but hold on. I do endoscopy.
Yeah,
Wait a minute. No, there's other things.
you do. Chest drains,
Yes. Well, I mean, yes, I do
you
those.
have
Yeah.
to do them. All those surgical stuff. It's not really surgical.
Oh my God, I can't.
You diagnose
I
loads of
yeah, but
things.
procedurally, there's actually
Oh,
very
right.
little that I will like. do procedurally. There must be other things. Wait,
There's got to be other things. Bone marrow biopsies,
yes, I do those. I do both.
joint taps, O tubes.
Yes, I do those. Okay, so there are other things, but I think, what I mean is like, we do huge numbers of fecal transplants. I am not really involved in those at all. You know what I mean? Like,
Mm,
so there's, more and more things that I just don't do. So the point of the story is, unless it's, a procedure that the vet has to do in our team, I don't do it.
yeah.
I mean, so that's it. And then because a lot of my job is really actually to do with paperwork and communication, and yeah, there's a bit of desperately scrambling through Ettinger or literature. So there's all that stuff that I have to do. There is thinking involved. But procedurally my skill set is more and more limited. I hope that kind of answers your question. Basically, the nurses and technicians are doing pretty much everything.
Everything. Yeah.
All that I've not placed a Freestyle Libre continuous glucose monitor. We were even, that there was a case report from the Journal of Veterinary Internal Medicine recently where there was a case that they'd used one of the continuous insulin delivery pumps on this one case.
Mm.
And so, one of my the team, one of the technicians was researching whether we could get one of those. I'm not saying we should all be getting one of those. That's very early stage stuff. But we're
It's cool that you've got a team of technicians that are just like, oh yeah, I'm going to just research this and I know I can take this to my vet and have a discussion about
yeah,
it.
and I think actually that particular technician had gone to a CE event where there was another internal medicine specialist. Tried not to be jealous, but another internal medicine specialist talking about diabetes, and which was great. And actually, she came back and said, well, she was talking about this sort of bolus sort of insulin, longer acting. We've got this case where he basically just eats when he likes, this little dog. He doesn't eat twice a day, whatever. And could this be a good idea? And so we have a lot of discussions like that where ideas will come from different directions and we make decisions together about, case management and things. So there's a lot of discussion and questioning and, I think that's very healthy.
Yeah, definitely. And I love actually that your first thought was client communication in terms of kind
Mm,
of ways that we can better utilize our skills, because I think that is I really want to reframe basic as like fundamental, because I think it
yeah,
is absolutely something that we have to be doing.
yeah.
In one of my previous internal medicine roles, worked with a medic who would give obviously discharge letters and everything for every client that goes away at his discharge. Theirs was like a Harry Potter chapter,
Mm,
maybe an Ettinger chapter, and it's very much I'd go through it with the client, and the client would just look at me with this look of fear on their face
yeah,
because there's so much clinical information,
yeah.
and and I think it speaks again to just kind of the differences in how sometimes things can be approached in between our roles, because actually, obviously, we don't have the level of knowledge that you guys have. And I don't think that that's a bad thing, because I think it allows us to have a very different type of conversation with the client. And I think it allows us to maybe break down some like perceived barriers. Maybe a client might be a little bit more apprehensive to say to
Hmm.
you as a specialist that they are struggling to give an insulin injection because they don't want to look like they're failing or they don't want to be vulnerable.
Hmm.
Whereas I feel that they would probably raise that concern
Hmm.
more comfortably or feel more comfortable being vulnerable with a nurse because they feel like there's a little bit less of a barrier, perhaps, or an expectation there.
Hmm.
Not that I'm saying that those things are there, of course,
Yeah.
but I think it really speaks to why we should have different members of the team involved in client communication and client support, because that helps you get all of the information that you need to manage that case more effectively.
Hmm.
And I think one of the other really important things that it does is it highlights to the public the perception of our role.
Hmm.
Because if we are just out the back doing everything, to use your words, clients don't see that. They don't see that there are veterinary nurses that exist. And I think that then feeds into the stigma that what we do is clean kennels and hold puppies and kittens.
Hmm.
And so what they really need to see is us being there, supporting them, showing how our role differs to yours in the
Hmm.
management of these patients. And the only way that they're going to see that and they're going to realize what we can do is by us being given the opportunity by people like yourself to get involved in that.
Hmm.
And nurses build relationships with clients just like just like you do. And I think that's one thing for me working in referral. Although of course there's the opportunity to do this in every practice, and I'd argue even more in GP. Like I have a set of clients that know me by name. I've had clients before where the medic's not been in that day, the patient's deteriorated, they've been offered an appointment with an intern and they've seen, oh, can I see Laura instead because I know her?
Hmm.
And I'm like, well, no, you need to see a vet, but I can be there. And so, and I know it's like with Inga, for example, with all of her oncology patients, it's very much the same. And I think it really just highlights
Hmm.
how much more of a role in client support and patient support we can have.
Absolutely. Yeah, absolutely. Absolutely. And I think, yeah, one of our technicians is there on a Thursday when I'm not. And, routinely, no, well, not routinely, but some of our clients will phone in a panic about something. And it's a shame to land reception with that, these kind of very bonded clients. And it just sometimes takes one conversation with a nurse or technician and that the problem is solved, and I think, an email this morning from a client about I given these oral fecal transplant capsules that are now available to her cat. And she emailed this morning saying, I mean, these are the biggest capsules I've ever seen. And I was like, oh, I mean, I've never looked at them. I've never opened the bottle. I wouldn't even know what size the capsules were. That'll be 100% email to our team saying, can someone please call this client and talk about what to do with these capsules? Because I don't know what to say to her. And again, I don't want that to seem really sort of, again, not the word basic, but this is actually really, this is the important stuff. That's the art of
Oh,
veterinary
yeah.
medicine. Like you know, I spend the majority of my time communicating with clients. Really, over 50% of my time is spent doing that. Why should the whole team not be involved in that process,
And I think it is very much like, as you were saying, with regards to what you're doing day to day, we just like we would approach clinically things different. I think we approach communication differently as
Hmm.
well. And so there are going to be certain things that the nurses focus on, like medication administration, for example, like more like lifestyle stuff, nutrition, things
Mm-hmm.
like that, that are
Hmm.
not necessarily going to be the aspects of disease management that you focus on. But if you've got a client that can't medicate the patient, your treatment plan is not going to work. And so it
Exactly.
really needs both of us.
Exactly. Exactly.
So I'm very conscious that what we've done so far is chatted a lot about referral and internal medicine. And obviously that's the case because that's what we both do.
Hmm.
But a huge amount of this audience are general practice nurses. And obviously they're going to be seeing medicine patients before we do.
Hmm.
So I would love for you to maybe share some words of wisdom for GP nurses who are dealing with medicine patients in their first opinion clinics, because a lot of people in my audience want to do more with their patients in general practice
Hmm.
and love nursing them in the wards, but perhaps don't necessarily feel like they know the best way to approach those patients. So as a vet working in referral medicine, when these patients come to you, what would you have loved to have seen like nurses do before that point?
I mean, I think honestly, the thing that is lacking with a lot of these patients is just simply that, and this is not again a criticism. I think the problem that I think a lot of nurses and vets are having in general practice is that their time is more limited and constrained, and that's,
Yeah.
you know, at the end of the day, if you or I were to go into a general practice setting, I mean, well, I can speak for myself and say I would really struggle because of the number of cases that are being seen and all that kind of stuff. It just would really, really be such a shift for me. So one of the major things we've got the luxury of is time. And so I think, with a lot of these cases, I think it's very unrealistic to think that you can deal with all of their problem in one sort of 20 or 30-minute, even whatever consultation. I think that the expectation that it can all be sorted in that one consultation is completely ludicrous. And I think that the majority of patients I see will never actually be cured of their problem.
Yeah.
And that setting of that reality for a lot of these patients, I think, is probably quite important. And that's often really what my job is to be like, we can manage this, but it's never going to go away. And we're going to be talking about this until the end of this patient's life. And sometimes actually just reframing that in the right way is really important. And I suppose giving these patients, if, making sure that we're then, if we can't sort the problem in one sort of setting, then these are great patients for, repeat consultations, but also for, nurse or technician kind of clinic settings. And if nurses are not running nurse clinics in their practices, then that's the most impactful thing that they can do tomorrow. Like that is where, for me, if that's not running alongside what your vets are doing, then that's the black hole. Like that's the gap in what you're doing. I think, otherwise it probably is a case of being empowered to push yourself forward procedurally and make sure that you are doing the things that you're qualified and capable of doing, and not just letting the vets continue to do things that they actually are probably not as good as you at doing. And I think it's even silly things like and again, silly is the wrong word, but the continuous glucose monitors, get good at doing them, just do a couple, and then before you know it, you'll be the one that's doing those all the time and helping clients with that sort of thing. So I think it's just, making sure you're pushing yourself forward in the right way to do the procedures that you're qualified and capable of doing.
Yeah, definitely. And I love so much that you said about nurse clinics, because I think that is in general practice probably one of the biggest things that so many practices are missing out on as a way to support their medical patients.
I know.
And because I never did those in GP, apart from my extent of medical clinics when I was in general practice, and granted it was a long time ago now, but was the vet might ask me to take a blood sample for them, or they might book in a patient for a blood pressure check,
Hmm.
and that's it. And that was very much focused on the I need you to get me a blood pressure, or I need you to take blood from this patient, rather than I need you to help me manage this patient
Hmm.
type vibe. So obviously I've been in medicine for a long time, and I've been lucky that clinics have just naturally been a big part of my role.
Hmm.
Probably because both referral centres I've worked in medicine were both brand new hospitals. And so we had very limited staff.
Hmm.
To begin with, we didn't have interns, we didn't have residents, we had one or two medics and one or two nurses. And so there was no way physically for the vets to be able to be seeing all of those cases. And so naturally the nurses did a lot. So I'd be seeing renal restaging, doing things like the EPO injections, doing renal like sub flushes and stuff like that. We actually got to the point where we taught all of the nurses to do sub flushes. So then the vets didn't even have to worry about whether they were going to be free at the time the patient was having their ultrasound, for example, and things like that. And that meant that the pressure was off of them so much.
Hmm.
Diabetics, all the freestyles. I had one patient that came in to see me for nurse clinics every 2 weeks for, I want to say, like a year and a half. And so like the relationship that the clients build with the nurses, but also it means that we're able to pick up on little things with the patients more, because we're maybe seeing them at,
Hmm.
earlier, so we can flag things to you that's going to impact the way that you manage the case or tweak a dose or whatever. So there is so much more that we can do day to day. And in terms of procedurally as well, as you say, there's a lot, there's definitely a gap, I think, between what we are legally allowed to do and what we often get to do day to day in practice. And obviously, this is me generalizing a lot, but I think it's fair to say that as a profession, that is probably very much the case. And I think what it takes to close that gap is conversations like this and more awareness of how nurses and vets can work together and how we can help each other.
Mm.
And so, from my point of view, in terms of delegation, it's very much a two-way street.
Hmm.
Like, we have to be just as active a participant in that as you are, even though, let's say you delegate for me to, I don't know, put a central line in a patient or whatever. You have to be happy, of course, that I'm competent and able to do that. But you also have to be happy that I'm going to speak up and I'm going to tell you if I'm concerned or if I don't feel able to do it or anything
Exactly.
like that. So there
Hmm.
really has to be that trust and that two-way, really strong relationship for that to happen. And so I think that's why more conversations like this will help with
Hmm.
delegation, because what it really takes is breaking down some of those perceived barriers and that perceived hierarchy, or actual hierarchy, as it may be, to help that delegation happen. So I would love to know, for you as a vet, like if a nurse that was working with you or a technician that was working with you wanted to do more,
Hmm.
what would be the best way for them to like approach you? And I appreciate that I'm saying this to you, who's like, yay nurses, yay techs, and is just going to delegate everything anyway because you're
Hmm.
awesome. But
Hmm.
like, as a vet, what would you kind of expect to what helps that conversation?
I think it's I think first of all, I think it's the having built into practice forums that people can actually speak up about the clinical care of patients. Like, I don't think that necessarily in all practices we are taking time to speak about patients in a sort of communicative and collaborative way. So if you're not doing sort of some sort of rounds type situation or getting together at points during the day to talk about patient care, then I think that's an obvious thing to be doing, because I think that would be a great forum for, for vets and nurses and technicians to get together and discuss ideas around patient care, which then would have, potentially evolve into procedural things that then, we could suggest that it wouldn't necessarily be the vet that had to do all of those things. I also think that taking the opportunity to plan your day and look at the diary and the schedule is another really key opportunity to actually optimize nurses and technicians doing things. Because if you can show that actually, if we do the day in this way and run appointments in this way and actually do nurse things at these times, we can get so much more done by me doing this while you're doing this, right? And that's actually for me, like, I'm always amazed when I look at my diary, and I think actually, no, well, we can fit these. I just again emailed someone this morning who, funnily enough, wants to come in for a repeat darbepoetin injection, and he wants to come in at a certain time on a Wednesday. I'm already fully booked with appointments. It doesn't matter. Doesn't matter. Yes, you can come in at that time. My colleague will see you, and we'll do all the things that you need to have done. So again, it's about looking at ways which you doing this procedure can optimize the whole workflow of the day. And I suppose the other thing would be to, particularly if you're doing sort of CE or CPD, is to be then communicating the things that you're learning off the back of that. And I don't think we do that enough. We do not take the time to disseminate the knowledge that we're learning from certain things, and that's wasted. So if you go to, a whole practical day CPD and you are placing central lines and getting to do some cadaver stuff or whatever, then you should 100% be then saying, I have learned about these things. I now need to be doing these things. And I think that's because that's what a waste of money if you're not then, I mean, it's great to go on a nice day of, free lunch and whatever, but if you're not getting to use the skills, then what's the point, I think.
Yeah, I think that's exactly it, isn't it? It really is. And I guess to add like the nursing perspective as well, if you are a nurse or a technician listening that wants to be doing more, I think the main thing I would say as well is just echoing what you say, like, don't be afraid to speak up.
Yeah.
But it does take a lot of, there needs to be a culture that kind of allows that to happen and facilitates those conversations. But even if you don't feel like your clinic has that culture where you can do that easily, find someone in your team that you can talk to. Because the more people that get together to start the conversation, that's what it's going to take to change the culture and get the team doing more. And that's ultimately like what every single practice, unless you work in like the unicorn clinic where it's just been perfect from the start, every single practice that has developed a culture has had to go from a point where they didn't have a culture like that
Hmm.
and they built that
Yeah.
themselves. And so there is no reason why anyone listening who wants to do more
Yeah.
but doesn't feel like they're in a supportive environment can't try to build that environment themselves.
Yeah, I think if you've not got an environment where you can genuinely say, can I do X, Y, or Z, then you've got bigger problems.
Yeah.
Like
Yeah,
I
for sure.
mean, that's wild. Like there's a bigger issue there.
Yeah.
Yeah.
I think if you are in that sort of environment, the question has to be, can I really develop the way that I want to here?
Mm,
And is this place the right place for my career?
exactly.
And that is a very different conversation.
Because there's plenty of places that are not like that.
Yeah, there are.
Yeah,
It just sometimes takes a bit of finding.
that's great.
Yeah, the right, like the places that you can thrive are definitely out there.
100%.
They really are. And there are people out there in the world, in the profession, like me, like Scott, that like want to see their colleagues thrive and do more.
Hmm.
It's just a case of finding those people.
Absolutely.
Oh, so what I would love to do, because I'm just conscious of your time and your day is just starting, is bring this together by just asking you one final question, which is, what is the one thing that you want every veterinary nurse listening to take away from this conversation? No pressure. It's not a big question or anything.
I'll tell you what that is actually. Yeah. So the thing that I think is really important to remember is that me or us vets, we don't own the knowledge, right? I just because I'm an internal medicine specialist doesn't mean that that gives me the right to claim the knowledge. You know, I am potentially sometimes the gatekeeper or the disseminator of knowledge because it just so happens that I've read the textbook literally multiple times and spent a long time learning about certain things. I didn't make up any of that information. Well, there are very, very
I was going to
tiny,
say which papers,
there
chapters.
are very tiny corners of the veterinary, tiny, tiny 0.00 something percent of the veterinary word that I actually published, right? So that's not completely true.
There's some good stuff
But
out there.
but
I've read it.
but generally speaking, I didn't make this stuff up, right? And most of the specialists that are speaking or disseminating information or the vets, they didn't make it up. They just went to vet school and learned about it. So they don't own the knowledge. And you, as veterinary nurses and technicians, have just as much right to that knowledge as we do. We do not own it. And so you have just as much right to learn and to speak and to disseminate and to be immersed in that information. It belongs to all of us. It does not belong to me just because I'm a specialist. It just so happens that probably, if I went and spoke at London Vet Show, people would come along and they think, oh, well, probably he knows what he's talking about, maybe, and so there's kind of a level of trust because I have a certain qualification. I do accept that. The value in what I can do really doesn't come necessarily from all the stuff I've read in textbooks. Where I can bring added value as an individual is the fact that I've done this job. I've done this job and I've done it for a long time. And so I've seen cases and I can tell you my experience of dealing with those cases. And I couple that with my knowledge. That you, as veterinary nurses and technicians, have seen just as many patients as I have. Yes, you've seen them from a different sort of perspective, but the wealth of knowledge that you have, that the power you have in actually seeing those patients, dealing with those patients, speaking to those clients, that is where your value is and lies. And you need to feel empowered to then disseminate that, talk about that, teach people about that. It's just as valuable as what I have to offer. And we can all read the textbooks and disseminate that information. That's not rocket science. That's literally there in black and white. You know what I mean?
I love that. I love that. I got told on Facebook a while ago by a vet that it's really nice that I want to teach people about fluid therapy, but the vets already know this, so I don't need to.
Rubbish. It's totally rubbish. It's completely rubbish. It's not even, it's
Yeah.
so,
Also, I don't know that many vets that know huge amounts about
no,
fluid therapy.
it's not true. And who gave that person the right to like, sorry, are you the president of fluid therapy? Like, what are you talking about? That is so ludicrous. What an absolutely wildly ridiculous thing to say. That's ridiculous.
Oh
And
yeah, it was funny more than anything, but I was like, it just plays into this so well. It's absolutely true. It doesn't matter about who has the most knowledge. What matters is how we're using it and the fact that we are all getting to use it.
yeah, and honestly, the val when I get asked to talk about subjects, right? When someone says to me, "Will you come and lecture on this?" The cold hard facts are we can all go to the textbook and we can read the chapter on that problem and all regurgitate that stuff.
Yeah.
I am selective about what I choose to speak about, and I've learned this because I've not always done this. But if someone phones me up and says, "Can you please talk about," I can't think, like if it's not cases that I'm seeing regularly or able to add a different like layer of experience to, I'll say, no, that's really not a topic for me. You know what I mean?
Yeah.
So, it's really my lived experience of dealing with these cases every single day that is where there is value. And no one can question that because that's just me. But
Yeah.
equally, I don't know how people find it in their minds to be then questioning you about, and like what? I really I can't fathom it.
I think the Facebook algorithm took that post to a corner of the internet that I don't normally end up on, I think is what happened, but it's fine. It's okay.
The vets know this already. No, they don't. No, they don't. No, they don't. The thing is, they
That's why
don't.
everything gets put on twice maintenance. Anyway,
Yeah, exactly.
I
Like
digress. That's a topic for
the
another
vet, what,
episode.
who said that vets know all of this stuff? It's so rubbish. Like we all know that's a load of rubbish. So,
Hilarious. Anyway, I think when we wrap this up, the other thing that I would really love you to tell everyone about is
oh yeah.
VTX, because I know that you also have the veterinary nurse eras,
Oh
which I don't believe Taylor Swift is going to be in attendance, but I mean, we've already got a pretty good lineup regardless.
yeah.
And yeah, just how can nurses and technicians learn with you?
Yeah,
And I also have a ticket to give away, don't I?
you do.
Because I'm speaking at
You do
it.
actually. Yes, you do have a ticket to give away. So yeah, so I think with VTX we do, we do a lot of CE or CPD, and we have various sort of ways in which we deliver information through webinars and online courses. We are very excited though about these kind of different events where we do live online events that are not, you're online, it's not in person, but it kind of still gives that kind of live element. So the speakers are delivering their sessions live, and there's an option, to then have a bit more kind of interaction, which I think is a nice kind of, not compromise, but an alternative to maybe always having to do stuff that's just pre-recorded, or always having to go to London Vet Show or whatever other shows are available, although it seems less and less. But, so I think not everyone can get to live stuff either. I mean, there's other amazing live nurse events. Lou is obviously doing stuff as well. So it's not just London Vet Show. That was a silly thing to say, but I think it gives people another option for attendance in a kind of interactive way. So we're doing the veterinary and the veterinary nurse eras, which is just a play on Taylor Swift. Again, her legal team have not been in touch. I don't think she owns the word era, so I think it's okay.
You can't have trademarked
She can't have
eras.
done
That's
it.
not going
No,
to be.
she's doing okay. I don't think she needs to come for me. But yeah, so again, just a sort of a play on that, but kind of looking at, different elements of kind of veterinary nursing. So, that we're very excited about that. That's happening in June, and all of the details of that are on our website. So we would be thrilled if people check that out.
Amazing. So I'm going to link that in the description
Oh,
below the
great.
episode, along with obviously your podcast, because
Oh, thank
this
you.
is hilarious. I went on Scott's podcast, 6 years
Oh
ago
my
when I didn't even
God.
have one. And now you're
A
the first out of mine,
long
which is very
time
exciting.
ago. Yes. Yes.
And I do have a ticket to the Vienna Eras to give away. So if you're listening to this, if you've got this far in the episode, message me on Instagram. And if you're the first person to message me, then you'll get the ticket.
I love it. That's great.
There you go.
That's
That's
great.
how it
I
is.
love
First
that.
come, first served. Ping me a little DM with your name and your email address and tell me what you loved about this episode, and I will then
Love it.
get it sorted.
Love it.
Amazing. Thank you so, so much for joining me, Scott. This was an amazing conversation. I am so, so thrilled that everyone's been able to get a really, really good perspective on vets and nurses from one of the best vets that I know. So I'm
Oh,
thrilled to have had you on. Thank you so, so much for joining us. And yeah, thank you everyone for listening. And I'll speak to you in a future episode.
thank you very much. It's a great honor. Thanks so much for having me.
If you've made it this far, then thank you so much for listening all the way to the end of the episode. And I have one more thing to ask of you before you go today. I would love to hear from you. Yes, you. I love hearing about the cases that you're seeing, the skills that you're using, and the conditions that you want to learn more about. Drop me a DM on Instagram. I'm at Vet Internal Medicine Nursing, and don't be shy. Come on over, say hello, and tell me a bit more about you. Talk to you soon.
I'm Kiana, and I leveled up my business with Shopify. Once I figured out that Shopify was a thing, I never turned back. I can create a site with my eyes closed. Shopify thinks ahead of us, and it thinks about the customer more than anything. Every day I'm thinking about some other new business, but Shopify is doing it to me because it's so easy to use. It's like I can't stop. I'm addicted.
Start your free trial at shopify.com.